Let's get into your first experience with spinal cord stim. A quick spoiler alert, there's more than one spinal cord stimulator.
I just didn't want to live a life of taking pain medicine forever.
Like, what are you doing now that you couldn't do before?
I'm just taking a lot less medicine, and
The
that's really it.
technology, I believe, also works over the phone in terms of being able to make changes. Can it be changed remotely?
That's
Meaning,
all on my app, which is on my phone.
welcome to the Zoom chat about spinal cord stimulators. I'd like to introduce Jamie, one of my patients. We're going to talk today about spinal cord stim and her experiences with it. And quick disclaimer, neither myself nor Jamie is paid for anything we're saying today. So this is just our opinions on the treatment and the option. So where I would like to start with you is if you can take me back to where your back pain started. How old were you? What happened? Give us a little background on what you experienced.
Sure. I was 31 years old. I was in a car accident, and unfortunately, I was in the back seat, so I got the brunt of it. We were hit from behind, and I felt some back pain, and I kept ignoring it for a few weeks. And about a month after the car accident, I woke up with horrible pain where I couldn't even walk, and I was rushed to the emergency room with lower back pain on my left side, and it was just radiating all the way down my leg, all the way to my toe.
All right. And then after that, I presume imaging, uh,
hmm
and they determined you had a disc herniation.
Yeah, it was a bulging disc. Yes.
Okay. And what were some of the initial treatments that you went through before we get to the high level stuff?
They did 24 hours worth of steroids through IVs, and that didn't work. So they immediately went to surgery. So they did the laminectomy and a microdiscectomy.
All right. So pretty much surgery straight out of the gates because it was bad enough that you were in acute flare up in the hospital.
Yeah,
So you had a laminectomy, no fusion, correct?
correct. I was too young. They didn't recommend a fusion for me.
Okay. And how did you recover? And then sort of what happened after that?
So recovery was about 6 weeks of bed rest. Obviously with a little bit of PT, like nurse PT. And I felt the pain, go away for a few weeks, maybe about 12 weeks or so, but then it came back. So for, about a year or so after that, it was just trying to get rid of the pain. So through pain medicine, seeing you, I think it was epidurals at that point, I'm not sure. But then we went to, I think it was a total disc replacement,
Right.
because we saw a surgeon and they basically said that where the original surgery was, the disc space was still small. So they said, okay, that could be causing the pain. So let's take the disc out, put the bones back to where a normal space is, and then put in an artificial replacement.
And the
So,
time frame there, what was that? That was over a year of like recouping and trying shots. How long did you?
yeah, I believe so. I believe it was about a year.
All right. So you gave it a solid, try after the initial surgery, and then you did go forward with the disc replacement, correct?
Yes, yes.
And then how was the recoup from that?
That was about, I think, 3 or 4 weeks of bed rest. And same thing, I felt a little bit of relief. Pain medicine was helping. But after about, I think, 3 months, pain came right back.
So then it's back to square one at that point with medication, with injections. Of course, you've been doing physical therapy throughout this.
hmm
So you had done all the simple things. And then let's get into your first experience with spinal cord stim.
Okay.
And a quick spoiler alert, there's more than one spinal cord stimulator story
Yes.
here. So how was the first experience? And we'll caveat by saying the technology has changed quite a bit
Yes.
between what you experienced with the first stim process and the second. So take me through the decision on the spinal cord stimulator at that point. Like, what was going through your head? You're two surgeries in, you're not 100% better. So
Yeah.
tell me what was
So
going on in your head.
for me, I felt like I just didn't want to live a life of taking pain medicine forever. And you and I tried every single injection that we could possibly do. And I just had to focus on managing the pain. So when the idea of a spinal cord stimulator was brought to me, I kind of thought it was, a little odd, but I said, what do I have to lose to try it? So we at that time decided to go with Medtronics and we did a trial. And I felt that it worked really well for me with the trial. And the procedure for the trial was really minor. I think I was on, resting just for a weekend or so. And then we decided to proceed with the implant, which I did. And I believe that was maybe like a few days on rest. But unfortunately, the implant itself did not really help me.
So
Um,
what you're bringing up is an interesting conundrum for us pain doctors.
mhm,
Um, Early responders and long-term failure,
yeah.
right? So the trial process, just to sort of explain that a bit for people who don't know, before you go forward with a spinal cord stimulator implant, you're going to try it out and see if you like it. Uh,
Hmm.
and that's someone like myself in an operating room. Usually we're putting in two electrodes in the back. So you're looking at twilight anesthesia, usually two needles in the back. Through those needles, we thread electrodes into the spine. What a lot of people don't realize is it's a little higher up in the back than you would think. So those leads are usually sitting in the mid thoracic spine, so around, T7, 8, 9 region. So kind of in the middle of your ribs. And that technology you're trying out at home with the wires taped to your back and the battery on the outside. So on the one hand, it's nice to get to test drive the equipment and see what it can do, but it's some of the challenges are you just had a couple needles in your back. So did you have a lot of soreness from that part of the procedure where like just the needles putting it in were causing some pain?
I think it was just a little bit of everything, just the fact that, like you said, like the needles and just, everything going on back there, just a little bit of discomfort.
Right. So at
Yeah.
the end of the trial, we did feel comfortable moving forward with the implant. Um,
Yes.
what year was that roughly? Just so I can put in my head what kind of technology you were working with.
I think that was 2017.
Okay.
Yeah.
So what you were experiencing, was it kind of the paresthesia feeling where it replaced your
Yes.
pain with like a pins and needly, tingly kind of thing?
Exactly.
All right. So just so people understand, that was the older technology.
Hmm.
So not necessarily knocking Medtronics at that time. That was the technology that was available. And for a lot of people, that feeling of the sort of pins and needly tens machine kind of sensation was better than the pain.
Right.
Now, as we alluded in your case, it seemed that we had a short-term success with the trial and a long-term failure. It's hard for
Right.
me to quantify that really, but I can't say you're the only time I've ever seen that. It's in the literature, even now with peripheral stimulators, which is a little different than the spinal cord stim. Um, they're finding that, there are people who fall into two camps. You have initial responders that get implanted and long term it doesn't work out. And
Right.
then what they're finding from the peripheral nerve stimulation studies, because some of those you can keep in for 2 months. So
Hmm.
you can do a 2-month trial with a peripheral stimulator. And there's patients where it doesn't work for like the first week or two, and then over time they start to respond. And so you have these like initial non-responders, which do turn into long-term successes. So it's hard. You're kind of betting the farm on 5 days of trying it out. So you
You
had
are.
stimulator in for how long altogether?
About 3 years. Um, and it was just sitting there because when I knew it wasn't working, then I just wasn't charging it because also the charging process with Medtronics was it was a very chunky, charger and it was a big process for me and it was like just I was very frustrated, living with chronic pain for so long, not being able to get rid of it. It puts you in a really bad mindset. So I ended up going back to the doctor and, I guess Medtronic came out with new technology and my doctor suggested that we upgrade to their newer spinal cord stimulator. And because I already had the wires in the back and they haven't moved, all they had to do was just open up the wound or the incision and just switch out the battery. And I said, okay, let's try it again. I personally am willing to do whatever I could do to get out of chronic pain. If there is a small chance that it'll help, I will do it. So I went ahead with that surgery. Um, and unfortunately, the newer technology did not help me either. I was in the same place I was beforehand. And that was, I believe, in 2020.
So
So,
now we're getting to where the high frequency stimulation option comes along. I think it was available a little before that, probably
mhm.
2018, 19. But now it's a pretty standard option. So how did that come about where you ended up switching technology? What did you switch to? How did that happen?
I don't remember the exact one, but I went to my doctor just basically, I was ready to say, just take the stimulator out. It's not working. And then he suggested, let's upgrade you to the new technology. We might as well try. And then I said, okay, let's do it. I'll go for the surgery and we'll try it.
All right. So that meant replacing just the battery, or you had to replace the wires too?
Just the battery, because I had the wires, they were in there and they were fine. So he said, we'll just do the battery pack.
All right. So now you're two full-on back surgeries, a trial, an implant, a battery change, and now
Hmm.
we're at the next battery change. So you're years into this process. And how did it go as far as changing the battery? Just kind of explain to people what's involved in that.
Sure. It almost was like the same type of recovery from the not the original, because the original I had the incision on the top as well, but it was just kind of like a weekend at home, maybe like 4 days or so. It's not too much pain. I'm a back sleeper, so that was my biggest complaint, that I couldn't sleep on my back. But I think the procedure was on a Thursday and I was back to work, I think that Monday. You take it easy and it really wasn't that bad compared to anything else. So
Right. So when you change the battery, that's a small incision. Where is your battery? Lower back?
lower left back, yes.
All right. So what that means is they didn't really have to go into your spine.
Right.
The battery's in a little essentially man-made pocket in your
Hmm.
right above your tush.
Hmm.
And everything's under the skin. So small incision, they just take out the battery just as if you were changing a pacemaker, except it's on your lower back. They're not fiddling with the wires, but they're able to change the battery. So that's a good thing for people to know who have a technology that's not working for them, that you may have other technologies available with those same leads in your spine without having to swap everything out. So
Right.
tell me about what you switched to and sort of what you experienced after the switch.
So that was just the higher technology version of Medtronics, and that one didn't work.
Right.
So I was just in the same place. And so that was in 2020, I think in January, maybe, or I think so. And then still, on pain medicine. And then it brought me to in 2023 when I saw a newsletter from you about Nevro HFX.
Right.
And it was about this spinal cord stimulator that was meant for people like me that have had failure with other spinal cord stimulators in the past. And that's when I was like, again, I'm willing to try anything. So let's try this. And that brings me to where I am today. So we did the procedure where simple battery swap out, because even though it was a different model, I still had the wires in my back. So we were able to just swap out the batteries. And it was the first time in my life, well, in 10 years since chronic pain, that I had pain relief, finally.
Now, what was different about the feeling? Like compare and contrast sort of what the experience like with the original stim and with this stim.
You know, I feel like the difference was that, after recovery, I was just able to do things, and it was just weird not needing pain medicine all the time, like getting ready in the morning for work and not being in pain, or sitting in the car for a long distance and again, not needing, pain medicine, and just doing all these things or going hours and being like, wait a second, like I haven't taken a pain pill. It's just living without constantly being in pain. And it's something I haven't had in so long. It was shocking almost.
Right. So what I'm getting at is the HFX technology, and I don't want to put words in your mouth, but the technology works on high frequency stimulation. And because it's at such a high frequency, you can't perceive what the electrodes are doing.
Oh, yes. Yeah, you
And
can't feel
so
anything.
you're not feeling anything. It's just an
Correct.
absence of pain
Correct.
compared to the other technology where you're feeling something, but
Right.
it's not really giving you the relief. You're getting this TENS machine kind of feeling, but it's
Yes.
not really making your pain go away. And with this, it's just an absence of pain and you don't feel anything.
Exactly. Like with the Medtronic one, yes, exactly. You'd have the tingling down the leg, which would supposed to, like numb the pain, but it was just like an annoying, constant, tingling down your leg. But with this, I don't feel anything. It's doing what it has to do, and it takes away the pain, which is amazing. You almost forget. You're just like, oh yeah, I have chronic pain. Okay. You're just living.
Right. It's a nice feeling to not think about it. And then you catch yourself saying, oh my God, I haven't been thinking about my pain.
Right.
Um, so just to be clear for people listening, you don't have to go through that whole process. Like this technology is something you can do out of the gates. I wish we'd gone to what's working for you sooner, because the technology was there, but I'm glad we got there.
Yeah.
Just so people understand like indications for a stimulator. Basically, it's for patients who've failed back surgery, or for complex regional pain syndrome, which is a fairly specific neurological diagnosis. Those are the two original ones. You obviously fell into the failed back surgery camp.
Yeah.
Two new indications have come out, which again didn't apply to you, but just so people understand, peripheral neuropathy from diabetes is now an indication for this procedure, and chronic non-surgical low back pain, meaning it was unfortunate for many years. Like you're telling a patient, well, if you have surgery and fail, I can do this. and they're looking at you like, I don't want to put myself through surgery just to try something like this. But now
Right.
there is an indication for non-surgical low back pain where we can get patients the technology, even if they haven't had surgery. The caveat there being that they do have to at least consult with a couple surgeons, and it needs to be documented that the surgeons didn't recommend surgery.
Mm.
In terms of your functionality now, like what are you doing now that you couldn't do before?
So I will say, I am, through everything, extremely determined. I've had a lot of people tell me I'm very resilient. So I've always, I've never let the pain stop me where I kept going, no matter what. So I won't say that there were activities I never did beforehand. It was just, unfortunately, living a life always on pain medicine. Um, so I continue to do the things I used to do. I'm just taking a lot less medicine, which was always my goal. There are a lot of people out there that might be okay taking pain medicine for the rest of their life, but I was never okay with that. I just, you
Right.
know,
People are conflicted. Am I dependent on it? Am I addicted to it now? And it's like we all have good intentions and we're using
right,
it for the intended purpose, but it just
right,
kind of eats at you like, am I dependent on this pill forever? And um,
right.
obviously, the goal of the technology is to get people off meds and improve
Exactly.
functionality. Um, I'm going to ask some questions that I think, people may want to know, even if I know the
Sure.
answer to. Can you see the device? Could anyone know that you have this in you?
No, you can see that I have a scar, but for
Right.
me,
But
I'm
if you're
always
walking around dressed like you're dressed, like nobody would know,
no,
right? There's nothing
no,
protruding from you or anything. It's all hidden under
not
the
at all.
skin.
Right.
Um, do you feel it in you? Like, are you
Um,
aware of it, or you just kind of forget that it's there?
I mean, I'm wearing jeans right now and you can't really feel it. No, it's thin. It's very thin. It's not as, big as someone would think. It's thin.
Yeah,
So,
it's about the size of a couple silver dollars put together. So it's not a very big device. Have you set off any metal detectors?
no, not at all. I always carry my card like I was instructed to, but I've never set off anything.
Have you flown with it?
Yeah, I
Uh,
have. Yeah, a couple times.
I would have guessed it would have set off a metal detector, but I guess not.
Yeah, it hasn't.
Um, all right. Any kind of advice you have for people, thinking about something like this? What would your advice be to them as far as, jumping into something that a lot of people think is a big, big jump?
I really think it's 100% worth trying. Yes, it's something that may work for some, may not work for others, but it is worth trying because chronic pain really does affect everyone physically, mentally, and, you know, it's not as scary as everyone thinks it is. For me, I'm proud of everything that I've gone through and where I am today. And without this device, I would not be living where, like how happy I am today and how like I'm just so much clearer today. And I'm so thankful and grateful for this. And everyone deserves a chance to get this. And I just feel like everyone, should really, they owe it to themselves to try at least.
Nice. Was this covered by your insurance?
Yes, it was. And at first, my first stimulator was not covered, and I actually called my insurance company and I had to explain the procedure, and once they understood what it was, then they approved it. So I think it's kind of a thing that they might not at first get, but I just called and they then understood it.
Yeah, there's usually hurdles. You know,
Yeah,
all in, you're putting essentially a BMW in your spine in terms
yeah.
of healthcare cost. You're out of pocket, I'm guessing was less than four figures, or I don't know. You don't have to tell exactly.
Um, no, it's
Every
okay.
plan's different, but it's
Right.
hard to say something's free. But in general, it was a covered thing where it was
Yeah,
financially manageable for you to get this done.
100%. And no matter what the out of pocket was, it's worth every penny to me. So,
And what kind of support have you gotten from Nevro in terms of HFX? Tell me a little bit about the company and how
oh,
they supported you.
I love this. So, every night there on my app, there's a check-in where it talks about how much pain relief and, the percentage. Has my pain medication went down, up, exercise up, down. And if I'm having a bad day and I don't have a lot of pain relief and that goes on for a couple of days, I actually get a text or a phone call just saying, hey, making sure everything's okay. And I appreciate that. I feel like just after surgery, they don't just disappear. They're kind of with you. I'm not alone on this journey. They're right there with me. And I love that.
And what's involved for you? Obviously, you're using the app, which gives the company feedback, gives you feedback to yourself as far as how you're doing. But as far as the stimulator technology, like how much work is there for you? Are you having to program it, turn it on, off, up, down? Like, what do you need? What's your part in all of this with the technology aside from the sort of tracking your daily function?
So they program it after the recovery period. And all I have to do every night is just a check in. And it's just a couple of simple questions. And at the end of those questions, it actually will give me the option where the app will say, okay, we recommend a new program for you. Or do you want to stay on the current program? And it'll give me that option. So the app actually kind of does it for you. And then if there's a program that I like, it'll say favorite this program. Like it's very easy and you do it all at your fingertips.
Right. So you were probably given several program options, right?
Hmm.
Then you can kind of choose between them. And I'm
Right.
guessing you kind of gravitate towards something that works. And then when you get to that point, is it just like set it and forget it kind of technology or
You
you have
can.
to, yeah. Have you done any adjusting on your own or the thing
I
figures it
have.
out itself? All right. So what's that like?
So, the way that you would do it is at the end of every single assessment. That's what they call it, where you do an assessment every day. And if I like the program that I'm on, even though they suggest maybe going to another one, I'll just keep staying on it and just say, keep current program, keep current program. And if I want to change it and try a new one, then I just take their suggestion.
And
And
the
that's really it.
technology, I believe, also works over the phone in terms of being able to make changes. Can it be changed remotely?
That's
Meaning,
all on my app, which is on my phone.
right. And the company could, in theory, change options on your phone, which will relay to your
Oh,
device.
yeah. Yes. Yes.
So there's an element of being able to adapt and change it, but also a set it and forget it if you're doing good kind of option.
Yes.
All right. Charging, is it as much of a drag as people complain about? How often do you have to charge it? What is that about?
So, which I love, the one thing I love about Nevro is I have two chargers. They were nice enough to give me two. So I have one at work, one at home. And it's a very thin charger. It's a very thin pad. And I put it right up against my back and I just lay down on the couch if I'm at home or if I'm at work. I put the pad right on my back, sit on my chair, and I just charge at work. And they told me when I first got it, just do it 10 minutes a day and you should be good. And I usually try to do that. Obviously, if I'm super busy and I forget and I'm very low, it does take a little bit longer. But again, if I'm laying on the couch or sitting at work, it doesn't really matter. So it really, it's a very easy process.
So just so people understand the technology, it's kind of like those iPhone chargers where you put your phone on a ring, and basically, it just rests on there. In your case, it's a ring, and then it's going through the skin, right? So just so people understand, you're putting it against the skin, Usually they give you a belt or something you can wrap
Yeah.
around or you can lay on. A lot of people do it at night in bed when they're watching
Yes.
TV and charge it. Does it get hot?
Not really. They say to you can put like something in between the skin and the charger so it doesn't get hot, but it never gets hot for me. But
Okay.
I will say they do recommend putting something in between the skin and the charger, but I don't do
All right.
that.
Now, what are your friends and family saying? Like, are they seeing a difference? What kind of feedback are you getting externally?
I mean, everyone's really happy for me because they know like the journey I've been on and they see a difference in how happy I am, and everyone's extremely supportive. They're finally seeing that something has worked for me. Obviously I still have some bad days, but overall, like this has been extremely life-changing for me, which is amazing, and everyone sees it. So
Awesome. Well, that's all of my questions. Is there anything you think I missed or that you'd want to add that people may want to know or don't understand about the technology?
Um, I don't think so, but if there's ever any questions in the future, I'd be happy to, answer through email or whatever. I'm
All right.
always happy.
Yeah, this will be posted on YouTube. What I will say to people out there is try not to put specific information about your medical condition on the comments in YouTube because we can't comment on specific. So general questions I can answer. And when we post this, we will also link to the company and to my local rep who could certainly point people in their area to someone like myself who does the procedure, an implanter. So I appreciate your time and
Of course.
we're really happy to hear that things are going well and that you could share that
Thank
experience.
you. Yeah, thank you so much.
All right.
All right.
Good night.
Bye.